Hi, Dr. Steve Tashiro. Welcome to Colorado Life-Changing Care. We're going to give you a brief tour of the office to show you some of the great options we have of treating your knee pain. To start with, I'd like to introduce Jennifer. She's our front desk patient care coordinator. So she'll welcome you when you arrive, get you oriented to the office, and she'll give you a tour showing you the different ways we have of treating knee pain. So follow me this way. You're off the hook. Okay, so this is my consultation and exam room. So you and I will come in here after your tour, and I'll talk to you about the history of your knee pain, how long you've had it, what you've tried, how it's helped, and very importantly, how your knee pain has impacted your activities of daily living. Then let's go next door to our regenerative medicine room. Okay, and this is our regenerative medicine room, and this is Jessica Crow, our advanced practice registered nurse. So Jessica is the person who administers the regenerative medicine injections, many of which are relevant and very helpful for knee pain. Jessica has a strong background in orthopedic medicine. She actually did her internship at a medical office in Denver that treats Denver Broncos, and she's also trained in family medicine. On that cart off her right shoulder, that square gray box is a ozone generator. It takes oxygen from the tank and converts it into ozone, which is very valuable in regenerative medicine, including in the treatment of knee pain. I'm going to give you a tour of our regenerative medicine lab. So this device is called a centrifuge. This is where we spin down or concentrate blood that we've withdrawn. And we use that in performing an injection called platelet-rich plasma, very good for joints especially. We work with blood specimens in this hood, and this is our freezer where we store our biological allograft cells. We use those to stimulate stem cell activity in the body. All right, so the next step on our tour is our x-ray room. We won't actually go in there, but it's right down this hallway. So the x-ray allows us to see important information about the knee. For example, how much space is in the joint, is it bone on bone, and what's the quality of the alignment. And based on that information, we formulate treatments to address those concerns and issues. Many patients find great benefit in their work with April.
Hello.
So April is a licensed massage therapist, and in addition to therapeutic massage, she uses hot stone therapy. Also, she teaches yoga and meditation. And so many patients rave about their time with April, so a very important part of our ability to care for patients. Okay, so we're back out in the therapy and rehab room. One of the very important treatments we use for knee pain, especially if there's compression of the joint bone on bone, is decompression. This is a computerized table. When the table is turned on, this cable retracts in this direction. As you can see, it's attached to the lower leg just below the knee. The body doesn't move because the body is stabilized on the table. So when this cable pulls in this direction, it actually opens the knee joint. It's a slow, rhythmic opening and closing. Very comfortable, not painful at all. And when we open the joint, it creates a vacuum that sucks water and nutrients into the joint space. And we've seen patients whose joint space has improved and increased as a result of decompression. Part of our program for knee pain is rehabbing and strengthening the muscles that stabilize the knee. So here's an example of how we might do that. So this is Bob, he's our rehab manager. He's going to demonstrate the strengthening exercise for the sartorius muscle, which is a very important stabilizer for the knee in the front. In fact, it's the most important stabilizer for the knee. It runs diagonally from the front of the hip down to the inside of the knee joint. So this is a procedure that would be done in the office, and often we do have patients do that at home as well. In the therapy area, here's Jennifer again, and we've set her up with infrared light therapy. We call it the Health Light. As you can see, it's entirely in place on her right foot. She's holding up the pad that we would normally put on the left foot. So the reason we do the infrared light therapy is to activate and improve the health of nerves that come out of the spine, go down the legs, they end in the feet. If these nerves lose their function, which is quite common based on statin medication, diabetes, other patterns of stress, so if that happens and the nerves become weakened, their signals into the spinal cord are less strong. And those are very important signals because they help intercept the pain signals coming from your knees. So this is a neurological side of knee pain that we look at and help people with. So the infralight therapy improves circulation to nourish those nerves, help them work better. So a session on the therapy system may be 15, 20 minutes, and that's a neurological side of knee pain. Okay, so this is the last stop on our office tour. You're looking at a shelf containing some of the supplements that we use to help balance body chemistry. Our approach to knee pain includes three facets. We look at the structural side of the problem, joint alignment, muscle weakness. We look at the neurological side of the problem. Are the nerves that block pain from the knee healthy and firing properly? And we also look at the metabolic or body chemistry aspect. Pain is a chemical process, and very often by reducing inflammation in the whole body, we can reduce inflammation and pain in the knee. So you've had a tour of the office. The next step is to actually come into the office. So we're eager to greet you, welcome you, and begin your journey towards a healthier, happier life.